Hello, I'm Dr. Patrick Hu, CEO of Moffitt Cancer Center here in Chicago at ASCO 2024. We're here with Dr. Monica Chatwal, a GU expert at Moffitt Cancer Center. Thanks so much for being with us here today.
Thanks for having me.
Hey, so GU covers a lot of different kinds of cancers. What's exciting right now about cancer research in the GU malignancies?
Yeah, I think there has been a lot of development in a lot of different spaces. Bladder has had a lot of improvement in terms of treatments. We saw at ESMO even the data that came out about EV Pembro that's truly changed our practice now in terms of improving survival for patients with metastatic bladder cancer. We have some of our own researchers doing trials on newer therapies, TIL therapies, and oncolytic virus therapies in early stage non-metastatic, non-muscle invasive bladder cancers. So it's really exciting, I think, to see the space grow and expand quite a bit and for us to be a part of that.
So tell us about viral therapies. Is that using a virus to treat cancer?
In some ways, yes. So it's kind of using a viral vector to kind of be able to deliver the drug in a more specific way rather than what we're typically aware of in terms of giving systemic therapy or even intravesical therapy that's going to kind of cover a much broader space and perhaps cause more toxicities that way.
And in advanced bladder, you said there is a new combination with anti-PD-1 plus EV. What is that?
So EV is enfortumab vedotin, which is an antibody drug conjugate, which is, I think, a really exciting type of treatment option that's become available in multiple different solid tumor types, breast cancer and now bladder cancer. And it's also a very nice novel way of giving chemotherapy drug in a more targeted form. And so EV is specifically targeting Nectin-4, which is a target on mostly bladder cancer cells, and so that's what really helps, I think, to improve its efficacy and kind of decrease some of the other systemic toxicities we see with standard chemotherapy.
So we're hearing a lot about antibody drug conjugates, so it's really exciting that it's being effective in bladder cancer. What about the other GU malignancies, kidney cancer, prostate cancer? We also studying ADCs in those cancer types?
Not so much right now. Kidney cancer, I think, it has really held steady in the benefit we see with the IO-TKI combinations. There has been expansion in different TKI opportunities. I think we're seeing data come out about another HIF-2 alpha inhibitor, which is another kind of novel way of targeting clear cell renal cell carcinoma, but not so much in the space of ADCs. And then similar for prostate cancer, I think right now we're still working on newer kind of targets, biomarker driven targets. And then what's really exciting is kind of the radioligand therapy space with PSMA directed radioactive treatments and how that will pan out kind of earlier on in the disease course.
I see, that's exciting. We had talked about that earlier about radiopharmaceuticals,
Yep.
right? So that's what you're doing in prostate cancer.
Yes.
So how well is that working?
Yeah, I think it's working very well. Obviously, we need to get more data about which patients will truly benefit versus others, but it's a unique opportunity to target where we're seeing some of these protein areas light up on PSMA PET scans and really being able to hone in on patients who can truly benefit. We know that radioligand therapy in some way has worked for prostate cancer. We've had Xofigo, which has been a radioactive treatment for years. And so now with PSMA targeted therapies, I think it can kind of push the field forward a little bit more. But I think what's also exciting now, and some of our researchers at Moffitt are doing this in terms of looking at treatments with bispecific T-cell engagers, other cellular therapies, newer versions of CAR T, which haven't been as effective so far, but I think certainly, hopefully we'll have more exciting developments in the future.
All right. Well, thanks so much for being here today, Dr. Monica Chatwal, expert in GU malignancies. Thanks for telling us about the exciting work that's being done in the GU field today.
No problem. Thank you for having me.